Hi, I'm Dr. Nicole and I'm at the Lacey office, and today we're going to be talking about acupuncture and pregnancy. I get a lot of questions about is acupuncture safe when I'm pregnant, and the answer is yes, especially if you're working with a licensed acupuncturist. And some of the most common things that we do treat when women are pregnant are morning sickness and nausea, abdominal and low back pain, edema, stress and anxiety, dizziness, sinus congestion, and headaches. This is really important because a lot of mothers either don't want to or they're not able to take over-the-counter pharmaceuticals or prescription medications during pregnancy. Also some digestive disorders and problems such as constipation or diarrhea, and also high blood pressure. So we're going to be working with Erin through her pregnancy, and we're starting this week with month 4, so please join us throughout the pregnancy. Hi, so I'm here with Erin today, and she is in her 4th month of pregnancy. And during this time, the baby is about 4.5 inches long and weighs about 3.5 ounces. And during the 4th month, the baby goes from the size of about a pea pod to about the size of an avocado. And during this time is when the heart and blood vessels will develop, and also the eyes and some of the other sensory organs. And so actually during this time of the month, you're able to feel the top part of the uterus. And how you can do that is it's about 3 inches below your navel. So Erin, if you want to take your fingers, you can kind of estimate it, but these 4 here, and go from your belly button down, and you can kind of put like a little bit of pressure right where that pinky finger is, and you can kind of feel a top part of the uterus there. So just kind of like a fun fact. And in Chinese medicine, it's a little different where the baby is also developing its blood vessels as well, but it's getting that energy or that essence from the mother's kidneys. So it's really important during this time to strengthen and tonify the kidney meridian in Chinese medicine. Traditionally in China, women would also eat lots of rice, fish, and wild goose to help with this. It was believed that eating these foods would help develop the sensory organs, as well as increasing and strengthening the blood and the qi of the body, as well as making the ears very sensitive to sound, and also brightening up the eyes. One of the things that we also want to talk about is there are some meridians that you want to avoid during pregnancy, depending on what month you're in. And for this specific month, it's the Sanjiao meridian. And that meridian runs along the tip of the ring finger. It travels up the arm, goes to the back of the supraclavicular fossa, radiates up to the neck, wraps around the head, and ends the lateral aspect of the eye. So during this month, some mothers will experience some heart palpitations where it feels like your heart's racing. They might get some acid reflux or notice increased hunger. This is mainly because the baby is developing a little faster, so it's really important to have healthy snacks available. And some mothers also might get a little bit of insomnia. So today here we have Erin, and she has a couple needles in for helping with regulating the digestive system, some abdominal discomfort, as well as stress, and also just overall fetal development. So the ones that are up here in the ears and in between the eyebrow, these are helping to relax her nervous system and alleviate any stress or anxiety. We have one that's like right on the center midline, and this is to help with any acid reflux or heartburn that she's experiencing, because when this happens, it's basically where the normal body function is to kind of down bear and go down. Hers is actually coming up, so having a needle slightly angled toward the navel will keep that energy flowing in the correct direction. The ones that are down here by her knees are trying to help to strengthen her overall immune system in her body, as well as the baby, because when mom's getting acupuncture done, so is baby. And we also have the ones that are on the inside of the ankle, and those are the ones that are relating to the kidney meridian, which I mentioned earlier, which we definitely want to strengthen and tonify. So I hope you will join us next month for Erin's 5th month of pregnancy, and we'll see how she's doing.